On behalf of our school, welcome to this public health conversation. These conversations are meant as spaces where we come together to discuss the issues that are core to our health. We are joined in these discussions by speakers who guide our thoughts towards deeper understanding of key issues. It is through this process of engagement and debate that we work to advance the ideas that shape a healthier world. Thank you for joining us for today's event, and in particular, thank you to the Dean's Office and our marketing and communications team, without whose efforts these conversations would not happen. A healthy world is a world free of injustice. For this reason, the pursuit of justice is, and always will be, core to the work of public health. Yet there is danger that in this pursuit we can often overlook when our own house is not in order. We can persuade ourselves that injustice is always external, something perpetrated by others, not by ourselves. This is, of course, sadly untrue. The truth is that while public health has done much to advance progress, it has also been party to wrongs. Today, we will reflect on a great wrong done to 623 Black men whose rights and basic dignity were violated in the name of public health. I have written about public health's responsibility to call out injustice when it is committed in the name of our field. Today's conversation is part of this process of acknowledging responsibility. We cannot fix the past, but we can acknowledge it. We can apologize for our role in it, and we can learn the lessons that help shape a future where such history is not repeated. Thank you for joining us today as we engage in these difficult, necessary efforts. I will now turn over the event to our moderator, Dr. Yvette Cozier. Dr. Cozier is a close colleague and friend who serves as our Associate Dean for Diversity, Equity, Inclusion, and Justice at the Boston University School of Public Health. She's also an investigator in the Black Women's Health Study and the Black Women Health Studies Sarcoidosis Study at the Sloan Epidemiology Center. Her long-standing research interests center around the social and genetic determinants of health in African American women. I always learn very much from conversations with Dr. Cozier, and I look forward to doing so from her and from our speakers today. Yvette, thank you for joining us. Over to you.
Thank you, Dean Galea, for that introduction. It is my pleasure to be moderating today's discussion. I would like to now introduce our speakers for this program. Mrs. Lillie Jewel Tyson Head is the president of Voices for Our Fathers Legacy Foundation. Voices for Our Fathers is a nonprofit organization formed by descendants of the 623 African American uninformed men from Tuskegee in Macon County, Alabama. They were victims of physical and social abuse in the United States Public Health Service Syphilis study at Tuskegee. I would also like to introduce Mr. Christopher Koller. He is the president of the Milbank Memorial Fund. In June 2022, he publicly acknowledged and apologized for the fund's role in the study. Before joining the fund, Mr. Koller served as the state of Rhode Island, served the state of Rhode Island as the country's first health insurance commissioner, an appointment he held from March 2005 through June of 2013. Thank you both for being with us today. I'm going to start this conversation with some questions that can give additional background and context to our audience. About halfway through, about 20 minutes left in the program, we'll turn to the audience for questions. I'd like to ask our audience to please submit your questions by using the Zoom's Q&A function at the bottom of the screen. So Lillie, to start things off, can you please talk about the importance of how we refer to the study?
Thank you so much, Dr. Galey and Dr. Kozer, and the Department of Public Health at Boston University for inviting me on behalf of Voices for Our Fathers Legacy Foundation to discuss on this forum a very important topic. Before I get to that, Yvette, talking about the name of the study, let me share a little background for those who might not be familiar with what happened in the study. Just a few remarks. The United States Public Health Service study of syphilis, study of untreated syphilis in the Negro male was conducted from 1932 to 1972, 40 years. And it was done by the United States Public Health Service. During the study, more than 623 men in Alabama were made to believe that they were receiving free medical care when they in fact were not receiving treatment. They were lured into the study by promising them that they would be treated for their bad blood. but not participants, but the subjects in that study, one of whom was my father, were told that they would also receive a free burial, and the men were told they would receive lunch or a meal when they would come for their testing. Today, this study is still impacting decisions on especially African Americans as to whether or not they will receive vaccines or how they make decisions surrounding their health. There has been much misinformation and misunderstanding about the study. And part of it is due with the name that you referred to in your question. The Tuskegee syphilis study, most of the people know it as the Tuskegee syphilis study or the Tuskegee experiment. This is a misleading title or name of that study. It should never have been labeled the Tuskegee syphilis study. And why? Because when you place Tuskegee at the beginning of that study, you give the ownership or place the ownership, accountability, and responsibility on Tuskegee. And you shift the blame to Tuskegee Institute and Tuskegee, which leaves a scar and a distaste about Tuskegee. So it should be. And after learning more about the study since the organization was formed, the study should be, and the name that we're asking everyone to refer to that study henceforth is the United States Public Health Service study of untreated syphilis in the Negro male at Tuskegee and Macon County. By not including Macon County in the study, you're disregarding the whole community of Macon County, where most of the men came from, in rural Macon County. They were underserved. They were not formally educated, but definitely self-educated. They were poor farmers. They were living in Jim Crow country with very few opportunities. So they were vulnerable, the most vulnerable, and they were used. So we don't want to continue to discard the community of Macon County at in talking about the study. And notice that untreated, you never see the word untreated when it was definitely the purpose of the study from the beginning, not to treat the men. It was only supposed to last 6 months, but it lasted 40 years.
Thank you. Thank you so much for that, that background. Really appreciate that. Turning to you, Chris, can you share more about the Milbank Memorial Fund's involvement in the study?
Sure. And like Lillie, I want to thank the community at the Boston University School of Public Health for the chance for us to tell these stories and reflect on them collectively. The Milbank Memorial Fund, I'll call it the fund, is a privately endowed foundation that was started over 100 years ago to improve the health of residents in all communities. We do it now by connecting leaders with the best available healthcare evidence and experience, and we focus particularly on state health policy making. We also publish the Millbank Quarterly. Over its history, the fund has been involved in a number of different aspects of what we now know as public health work. It's only in the last 30 years that we've shifted to more of this public health policy role. And in October of 2020, amid this national reckoning on race and inequality, the fund began its own diversity, equity, and inclusion review that included a full examination of the fund's history, including our involvement in the study that Lillie just spoke to. Our involvement is specifically that 3 years after the study was started, so this would be in 1935, through 1973, at the request of the Surgeon General, the fund paid for services associated with the burials of men who died over the course of the study. as Lillie alluded to, specifically, the funds were made available at the request of the Public Health Service to incentivize families to allow government researchers to conduct autopsies. That's the best way to find out the effects of untreated syphilis for men who died in the course of the study. We are ashamed of our role in this. I will just say now, when you lay it out so graphically, I think the leaders of the fund at the time had no sense of the indignities and the deception that were involved with this. The fund's involvement in the syphilis study, in the U.S. Public Health Service study of untreated syphilis, has always been a matter of public record, but it was not well known, well documented, and we certainly had not confronted it. And as we went through this exercise, we actually hired a historian who'd written the book about the study, Susan Reverby from Wellesley College, to document exactly what the fund's role was. In the course of that, the board came to sort of the following sort of principles, if you will. The board and staff gained a much greater appreciation for how the study compromised the trust the Black Americans and other people of color, the lack of trust that they have in the U.S. healthcare system, as Lillie just spoke to. We also thought it was really important that we had to acknowledge our role publicly in a way that has not been done before. And we thought that to do that, we really had to focus on starting with the people who are victims of the study, the people who are directly harmed by it. And that led us to Voices for Our Fathers Legacy Foundation and Lillie Head. That was where we really wanted to, we had the facts. What we wanted to do was to acknowledge our role most directly to the people who are most directly harmed, the group represented by Lillie. And so that's what has led us to this point.
Okay, thank you very much. Can I just ask just a clarifying question for the benefit of those who are less familiar with this study? So the fund paid for the burial only if autopsy was allowed. And Lillie, what is the significance of that specific request? What is it about autopsy in particular?
I'm glad you asked that question, Yvette, because it tells the story of what the study was intended for and the purpose of the study and how the men were used. They were used as lab guinea pigs for only to wait until they died so that they could see the results of how syphilis played on the bodies, on their bodies. And it's really disturbing when you know that that information was already out there from previous studies that had been done on men. But because of the racism that was in the system, and still there's racism in the system, and the belief that the Black men were not conscious of their health and would not go to the doctors for treatment. Also that they receive pain, or they could endure pain better. And also because of how they felt that syphilis would affect their bodies. They thought it would be more cardiovascular and less neurological. So they were used as lab guinea pigs, if you will. And the autopsies was the only way they thought that they could prove the point of the Blacks being less than and not worthy as equal in body and as white men. That was the significance of that.
Thank you for that. So staying with you, Lillie, can you please share more about your father's legacy and the work of the Voices for Our Fathers?
In talking about my father, Yvette, I am only using my father in most instances, but my father is a representative. It's just one of the 623 men, of which I knew several of them. In fact, I had other relatives in the study. So when I talk about my father, I'm talking about all of those men. And I like to say that to me, they were the heroes in our communities at that particular time. I'm from Tuskegee. I grew up in Tuskegee. I went to those rural community churches in Macon County. So I had a feel, or I have a feel and a dear love for the men and their families in that community. So I'm talking about all of the men, including their wives and their children. The legacy that they left and should be an example today is that the trust that they still had in the doctors when they told them that they had bad blood and that they would treat them. There was a trust that they were being treated when they were denied a treatment. And there was little opportunities for the men to know more about what was happening to them, or to know what questions to ask about what was happening. Although some of the men became suspicious doing the study and they left or stopped going, and my father was one of those. Also, the men legacy has the narrative of their legacy and the character. They're left dehumanized by that study, and which is part of why Voices for Our Fathers Foundation was started. We wanted to humanize the men and to honor their sacrifices and remember their suffering, and to make sure with our voices we could help to ensure that a study like this would never happen again. So Voices for Our Fathers was organized in 2014 by descendants at Tuskegee University to have the men's voices heard. They were silenced. They didn't have that opportunity. So now we know. So what are we going to do with what we know and speak on behalf of our fathers? And we know that they would be wanting to speak out about the injustices that was done to them, and they would want to advocate for others to ask questions and to get involved in changing the health system and the inequities and the disparities in the health system. So we're trying to do that. We do have a website, and I think it'll be up in the chat someplace, so that you can go and learn more about the work that we're doing. And we invite others to join us in this effort, because we do need to change the way and the care that the most vulnerable and those who need it the most are being treated.
Thank you. Thank you. So turning to both of you, can you both share a little bit about your initial conversations? What was that like, and what stood out to each of you? So Chris, I'll start with you.
Yeah, that's the moment. So this is, and you see Lillie smiling because we've gone through this before. So it's September. We've been going through this process since the spring. We now have Dr. Reverby's history. We know the facts. Keep in mind, this is happening during the pandemic. The process that the fund is going through is happening during the pandemic. There is a lot of discussion going on around vaccine hesitancy. We are, frankly, I'll be corporate, from a risk management standpoint, concerned about what our exposure might be and what the risk to our reputation might be as this becomes more public. But we've made this commitment to apologize, to go public. Our board was very clear on that. We've identified Voices for Our Fathers. We've identified Ms. Tyson Head as the chair. We've seen she and Voices for Our Fathers have done a number of very effective public service announcements around basically saying I'm a descendant of someone in the study. I got the vaccine and so should you. But we have to make contact. And we decided that it was not going to be by letter, that it had to be a phone call. And so there was just one morning when I had Lillie's cell phone. It was available on the website. And I just picked her up and called her cold. She didn't even get the name right in the beginning. She said, "What? Millbrook? Who are you?" And then she said, she was in the middle of something. So she said, "Okay, call me back tomorrow." So I called her back tomorrow and went through the facts of it. We started talking. What I conveyed was that, first conveyed these are the facts and that we are, how sorry we were and that we wanted to apologize. And Lillie we were about 45 minutes into the conversation and Lillie paused and she said, "I feel like you are an angel sent by God." And I certainly didn't feel like an angel at that point, but I knew I had experienced something very special. And that was the next stage of this process that we continue to be engaged in. I will, Lillie, I'll jump ahead a little bit because she said, we said we want to write a letter and we want to speak to the board. And subsequently, we did that. We wrote the letter to the board. It was an apology. It stated our desire to make reparations. But when we got to the board meeting, Lillie kind of surprised us and she said, "I think the apology needs to be public. And I think we ought to do it at Tuskegee." And this is the magic of virtual meetings. And the representative of the board and I were in different places, but we both could say, we just sort of nodded and said, "Yep, we're in." And that sort of went to the next stage of this process. And there was an element of trust involved in it. We knew that we were working with, or we felt we were working with someone we could trust in terms of how this process would work out from here. And it may seem odd for an institution that's apologizing to think about trust, but it was very important for us as well. So I'm sorry, I went on, but I'll just stop there.
No, thank you. Lillie, how was that to receive that phone call?
It was surreal. And let me say first that Chris mentioned something about, I felt like he was an angel. I also said that the Holy Spirit was involved. I believe in the Holy Spirit and how the Holy Spirit works. And now I'm a Catholic, and I also know about confession. And listening to Chris, I thought I was a priest listening to Chris' confession. But
you were, Lillie, you were.
but it was quite surreal. And I really didn't know how to digest it, I guess you could say, or how to process it. So I listened carefully. And I also thought about the words of my father and how he would always say that you can do more by listening and trying to understand than you can by ranting and raving and carrying on with a lot of ill feelings. So I tried to make sure that I kept all of that intact. And I also thought about how the Bible talks about forgiveness and how it's important to forgive, both for the person who needs forgiveness as well as the person who's forgiving. That's important because you will carry that heavy burden of hatred and non-forgiveness, and it can wear you down. So I didn't want to put myself in a place where I would be non-forgiving and angry and upset. Yes, there were emotions that came into play with that. And yes, there were emotions and thoughts that came into place. What took you so long? And there was, thoughts and thoughts are coming in to say, why now? And what are we going to do about it? And that was the most important question. What are we going to do now? Now that you have apologized, where do we go from here? How can we come together to make a difference and to change things so that things will be better for everyone, and that we can't erase what happened. We can't forget about what happened, but we can take knowing what happened and make things better now. And that's what Chris and I are attempting to do and trying to do, to show that you can apologize and you can accept an apology and you can forgive and you can work together to make things right. And that's what's going to have to happen to change our system, is attitudes are going to have to change, acknowledgements are going to have to change for us in order to move forward. And I like to say one thing too, the example that Chris and Millbank has set, because their apology was unsolicited. In fact, if I ever knew about Millbank involvement in the study, I had forgotten it. So when he called and told the story of Millbank, I was really surprised, and that too came into mind, that he came forward on his own. And I think that too has to happen. Acknowledge the past, the injustices and the wrongdoing, and accept the responsibility and show some accountability for what has been done. And that's the only way trustworthiness is going to be restored or strengthened. And then we will be able to move on to trust.
Thank you. I can see from the audience reaction that apology and acceptance and trust, mutual trust, has really struck a nerve. And I think in this current time when our society seems to be going in absolutely the opposite direction, what types of lessons can this action between the voices of our fathers and Millbank teach the rest of us? In public health, we work often with marginalized communities, and there's often a lack of trust. How can you help inform us in our public health practice, if you will? What advice would you give us?
First, I would say, in working with the marginalized and those you think that might be a little, say, less or not deserving, take the love of humanity with you when you're caring for them. That's the most important thing, is treating everyone with the respect and the dignity that they deserve, no matter what. And we can see that every day when people go to doctors and emergency rooms, especially those without insurance and those who are homeless and the mentally ill and so forth. We have to, that's the first and most important thing. And I think that should really be the top of the beginning of any class introduction, is the humanity and the work that you're doing. And then from there, be truthful and honest and transparent about the work that you are doing and whatever treatment or care that you are giving. And then if something should go wrong, be accountable for it and acknowledge it and try in ways to make it right. You can't erase it or undo it, but you can try and make it right and make it more amenable and correct perhaps some of the things that have gone wrong. And then after after you've gone through that, I think trustworthiness will start. But each and everyone has to put on that or put that attitude about humanity in their hearts and in their minds when they're treating and caring for another individual. And I'll close by saying, when you treat one person, you're not just treating one individual. You probably will be treating a husband. You might be treating a wife. You're treating probably a family, more than likely, and you're treating a community. So it's not just one person that you're treating. You're treating a lot of people when you're treating one person. We're all in it together, and we're all humans.
Thank you. Thank you. And Chris, I'd love to hear your perspective as well.
So I'd really start right where Lillie does. The best service we can do is in all of our interactions and all of our relationships, treat one another with the dignity and respect that they deserve. Often we lump into groups, and there are reasons to do that, but each person is a person and is deserving of respect and dignity. And I think if that connection, if that realization had been with the fund in 1935, it wouldn't have participated in this. If there had been a connection with the researchers, I dare say, if you see the inherent dignity of the individual, then there are all sorts of things that are off limits in terms of how you treat people. You have to disclose to them what's going on. You have to be honest with them, and that all the things that were denied to the men in the study. I think, and I agree with Lillie about the ripple effect. I think what I would just for our conversation about sort of where do we go from here. There is a framework that the National Collaborative for Health Equity uses around truth, racial healing, and transformation. This is directly as it applies to racism. It speaks to the steps that the funds and voices are engaged in right now, and this notion of identifying the truth and acknowledging it, apologizing where necessary, going through this often long and not linear process around racial healing to lead to transformation, which is kind of our goal. It's like what King talks about, the beloved community. But this is not and the funds, I will say on behalf of us at the fund, we struggle with this. It can be like a checkbox exercise. Okay, we've done that issue. Now we can go on with our work. No, we carry this with us. It's part of who we are, and it has to. There is an accountability to Lillie and to voices around how we as the fund are changed as a result of this. So I'm not sure those are lessons. They're kind of reflections around this, and kind of getting past the hard and fast general ideas to more specific relationships and what comes as a result of that. And maybe the last thing on it, and I'd speak for this as a white person and coming from a position of relative speaking power, you're known by the company you keep. And I think there's an extra burden on folks who have benefited from power and privilege to diversify their relationships. It's too easy to get segregated and end up in our particular circles. And bad things happen when we get segregated. That's how we create trouble. That's how, again, we got into the study of untreated syphilis, is because people felt detached or distanced from one another.
Yeah. Wow. Thank you.
If I could just add to that, I'd like to encourage also everyone who's involved to, if they see something going wrong, to say something. That study went on for 40 years. And even though some people knew about it, nothing was done. No one really, I guess you could say, really raised the red flag and said no more. stop this. And had it not been for Peter Buxton, who came across the records as he was searching for researching on another topic, we wonder how long the study would have lasted. So when you see, and I know it's a colleague, and I know the bond that colleagues have, and the privacy that exists, and you don't squeal on the coworker and so forth. But when you see something that's wrong, say something, and make sure that whatever is going on wrong is immediately stopped. So that's another part of what you can do to start building the trustworthiness that will lead to trust.
Thank you. Thank you. So we have a few questions in the Q&A, and I'd like to turn over and pose a couple of them. So one question that I'd love for each of you to respond to is, do we know what happened to the partners? And Lillie, you're obviously an offspring of someone who was in this study. We hear, the study was focused on men. Obviously, as you said, it's not one person, but it's a whole community. What of their partners and families and their health?
I sometimes bring my mother into the conversations when I'm doing interviews and talking about the study. Some of the women did contract syphilis from their mates, and some of their children contracted syphilis from the mothers who had contracted SAIDS. I don't know the numbers, but I do know that happened. And there are some of the children, a few of the children that I know of that are still living and are still, I won't say suffering, but are a part of the medical program that was provided by the CDC for those who had resulted in being infected by that. We know that a lot of the children were stillborn or died during that time. So it was a lot of suffering going on, and the people really didn't know how. Now, that's another good research project to find out what happened to the women that were identified, and there were women and children identified as having syphilis. What happened to them? Were they ever given any type of treatment during that time? That's another part that needs to be answered. And then also, we spoke about the autopsies. We still don't know as descendants how those autopsies were used, where are the specimens, and what was learned from 40 years of taking specimens and spinal fluids and blood samples from the men. How were they used, and what was learned? And we are looking into working on trying to find out that part of the study. But that study had so many layers of injustices that was done, and there's so many answers that are still not answered, and we want to try and find those answers.
Thank you. Good. So, thinking about the apology and in terms of compensation, have any of the families ever received compensation from this, either from the fund, or I know that President Clinton did issue an apology about 25 or so years ago. What other things have been done for the men in those families since?
So President Clinton apologized, and as part of that apology and the work of a number of folks who were advocating strongly at that time, and Lillie can add to this, a promise was made of free health care for the men in the study, their families, and I'm not sure about their descendants. Lillie, you can speak to that. There was a fund that was administered.
Well, the families, as I mentioned, the ones who had contracted syphilis, that they connected with the fathers, they receive medical care now and probably will receive burial. The men who were still living, now there were about 100 men or so who had passed before the lawsuit was filed in 1973 by attorney Fred Gray on behalf of Mr. Charlie Pollard, who asked attorney Gray to file the lawsuit, and it was a class lawsuit. And there was almost $10 million. It wasn't quite $10 million that was granted. And there were two groups, the syphilitic group and the control group. The men who were in the syphilitic group, which was 423, those men received a certain amount. And then the ones who were in the control group received a certain amount, and it was lesser than the one who were in the syphilitic group. And I must say, most of the men in the syphilitic group had latent syphilis at that particular time. So from the class action suit that was done in 1973, they received monetary stipends, I would say, because it was nowhere near the suffering and what had been done. And then those men also who were still living, they received a medical health care plan that they could seek medical care and so forth. And they also received burial. And my father received that, so that's how I know they received. When President Clinton apologized, that was no monies or anything that went to the individuals. It was just an apology for what the United States Public Health Service had done on behalf of the nation, and it was done at the White House. And then what came out of that was the National Center for National Bioethics Center in Research and Healthcare. And that's at Tuskegee University, and it's the only center like that on an HBCU college campus. So that was a part. And when that center came about, the descendants started to go to Tuskegee to commemorate the apology. And that was in 1999 when the center opened, and a soft open, I should say. And we have been going ever since then, except when we were interrupted by COVID. So we haven't been in the past 3 years. Now, Chris, we didn't mention the fact that we have a partnership, and Chris and I so far have been doing a lot of speaking and talking with different institutions and medical agencies since the apology last year in June, which is really great when you see where you have the two going together, and it's we speak on behalf of harm and healing, which is really good. And then Millbank also gifted the foundation $2 million, but that goes to the foundation to help us in our work, and so that we will be sustainable, or help us to be sustainable for years to come, because we really want to do our work and our due diligence on helping to bridge the gap or build a bridge between the distrust and the trust that we still feel in the African-American community.
Thank you. Chris, would you want to add to?
The part about our payments to Voices for Our Fathers wasn't clear. Maybe just more of a reflection. This is less about the payments question. Note that while there was a lawsuit that was filed and a settlement that was eventually agreed to, it took another 25 years for an apology to be issued. And so you had a settlement, but I don't want to speak. It was that settlement was incomplete without the apology, and it's still not complete. But we needed to what we were talking about earlier around publicly saying the truth and publicly apologizing. Lawsuits don't get there. They get some things, but justice isn't. It's partial justice. The apology, the acknowledgement, the public acknowledgement, the apology is equally important.
Yeah, no,
And,
absolutely.
and to go beyond that, show some actions.
Mhm.
Yeah.
I mean, you can say, I'm sorry, so what? You know, what are you going to do about that? What's going to change?
Yeah, that's very true. There's one question here that I think is a bit more philosophical, but I'll throw it out anyways. Any ideas for building structures within a society that has structural racism at its foundation so we can grow beyond each other's humanity and really change policy and systems? That's kind of very broad, and but again, your actions together have, sorry for the ambulance sounds here, but your actions have really been quite important. And just to sort of add to that, thinking about like the South African Truth and Reconciliation Program, is that something that could work here in the US, do you think? Could you be an example of that?
I think we could be. The question for me will be, where would we begin with that, and who would start it? And thinking of that, I do believe what Chris and what Millbank and Voices are doing together is a good example on how restorative justice can begin. And I'm not sure when the person who asked the question, I'm not sure what they meant when they said move past humanity, I think, to policy. I'm not quite sure on moving past humanity. I understand the policy has to be in place. That's going to make sure that things are going to get done the right way. But I think the humanity has to go into that policy before the policy can even be made.
Yeah, I think it's maybe just to that point, maybe not moving past humanity, but really not being totally dependent on, having to appeal to people's better angels. Is there a way to sort of make people sort of come to the table in that regard, I guess, is my thought. But Chris.
Well, I when I heard that question, I automatically started thinking of policies. I started thinking, well, universal insurance or housing policy and zoning laws and things like that. And I think those are all important, but we shouldn't. Lillie regularly reminds me, Lillie, I thought you're going to use the line, you don't move past, you move through. And that's not my line, that's Lillie's. And how can we set up structures, processes that allow both that allows the community to move through this experience of racism, this experience of injustice, and not move too quickly to a solution. And I think about this for myself. To be honest, and these are kind of loaded terms, I thought I was a pretty good guy. I didn't think of myself as a racist or anything like that. But this experience of the last couple of years of being with Lillie and being with Voices for Our Fathers and hearing the stories, it's just a profound and deeper experience. I wish everybody could have that. This experience, I wanted to be sure you have a chance to tell the story. Last June, for the public apology ceremony at Tuskegee, these bus rides from Auburn to Tuskegee, Auburn, the green lawns, SEC football, you go to Tuskegee, and we're riding with families who've come for this apology ceremony, hearing their stories of the ones who moved, who left Alabama, the diaspora, the ones who stayed, what brings them back, what the varying significance of the study of untreated syphilis to each of them, because there's not one universal experience. We don't, and then the apology ceremony, and having Lillie say, "We accept your apology," and then holding hands and singing "Lift Every Voice and Sing." I would wish that for all of us. I really, and since I can't do that, we can at least tell the story.
Wow, thank you. So just, I'm sorry, go ahead, Lillie.
I'm sorry. I just wanted to say that's all about getting to know you, you know?
Yeah.
And if we all get to know each other better, with an open mind and a warm heart, and sincere heart, that's what happens.
So I'll, with one of the final questions, because we are getting close on time, is then thinking and looking towards current efforts to suppress the history of racism in the US, both in, elementary and high school curricula, creeping into, college curricula to some degree. What do you hope public health will do to resist this covering up of the truth, or what we will do as in the United States to go through history and come to this sort of reconciliation? Feel this discomfort around this, I guess.
Chris, I'll allow you to go first.
Yeah, if I understand the question, I think it's, and I say this as a, I teach in a public health school a little bit south of Boston, down in Providence, but we won't mention its name. We'll just say it's another one that's down there. I think it is the leaders in public health institutions bear responsibility to make sure that different voices are represented. It's the learning experience. I'm going to speak to public health schools in particular, to create a learning environment that is both principled but humble in terms of how we encounter one another. None of us has a monopoly on the truth. We should be trying to, I think, foster honest exchanges between individuals, as opposed to assume there's a correct way of thinking. And public health, like any other place, can be a prisoner to one correct form of thinking. We have to be careful to learn from one another. And I think that a particular capacity that public health has is the ability to convene and the ability to lift up, to pay attention to power, and to make sure that the power is evenly distributed, power mostly in terms of voices, and who is speaking, who is sharing their stories, and how policies are being developed. And I think that's a particular skill that public health has a leg up on that, because they're tuned to it. But that requires attention and intention to sort of say, who's in the room, who's not in the room, whose voices are being excluded, and what can I do from my position to include some of those voices?
Yes, thank you. Any final words as we get close on time here? I want to make sure that we hear from both of you.
I just have a few sentences to say about that. And the first is no public health history. Know the history of public health, and then learn from that history, especially when there are blatant and injustices that are done, and the care for human beings. Start there and then move forward, always remembering the history. And I hope that public health will be an example going forward, understanding what happened in the past can never continue or will never continue to happen or will not continue to happen in the future.
Well, I want to thank you both so much for this conversation. Your combined actions and your individual actions are really a roadmap for all of us, especially during this time when we tend to talk past each other and not listen. So I, for one, appreciate what you've done, what you've both done. At this time, I'd like to turn things back over to Dean Galea.
Thank you, Dean Kozier. So as Lillie, if I may, and Chris, as you've both been talking, I've been getting texts and emails from colleagues from all over the world, roughly saying the same thing, which is, if only we could have conversations like this about difficult issues all the time in our society. And I would take that as the highest praise for the two of you for what you've done, and to Dean Kozier for facilitating. And I suppose my answer to if only we could is I'm a firm believer in the power of conversations that catalyze change. And I feel like one good conversation leads to two, which lead to four, which lead to eight. So I am so deeply grateful to the two of you for having this conversation, for leading by example, and for sharing the conversation with us. I have learned enormously from both of you, and I think so has our audience. So I want to say thank you, Lillie, thank you, Chris, thank you, Yvette, thank you. And I want to thank our audience. We've had a absolutely fantastic audience, truly engaged, really, really interesting questions, really interesting comments. And you know, if all 1,000 people who were engaged in this conversation, either through Zoom or through our other streaming venues, actually have similar conversations with just another 10 of their friends and colleagues, that's 10,000 people who are now having good conversations about difficult issues, and that's how change happens. So I am immensely grateful to everybody who has given the time, both to present and to be part of this conversation. And thank you to everybody for all you do every day. Everybody, have a wonderful afternoon, evening, and day. Take good care.
Thank you. Thank you all.
Thank you.
Bye-bye.
Bye-bye.